You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Jennifer Krippner, who is the Chief Experience Officer at the Institute for Healthcare Excellence. Welcome to the show, Jennifer.
Good morning, and thanks for having me.
It's so good to have you here. So tell our audience a little bit about your background and what you've been innovating these days.
Wonderful. So I've spent my entire career in healthcare, and which seems like a long time now, but back in the 90s, I joined healthcare from a marketing communications side of things and really found my way through different types of roles, really from a kind of an innovative way. And that really found my way through new roles that have never been created, like joining an organization that never had a role for marketing and communication, or found a physician development and relations role of a brand new building in a new community where we needed to introduce physicians to the community. And then my last position before the one that I'm in, we actually built a brand new hospital in a community that had never been done before, and from like the hole in the ground. So we were able to build a hospital that was like, go build one that nobody's ever been able to experience, like the best patient experience, the best physician experience, the best employee experience. And so I've always found myself in these kind of innovative, collaborative experiences. And so I really seek out ways to bring new life and new ways of doing things to roles that I've been in healthcare. And so when I was asked to join the Institute for Healthcare Excellence in 2016, the organization had only been around about a year. And so I jumped at the chance again to see what I could offer that organization.
So tell us about the Institute. What does the Institute offer to the healthcare ecosystem? And then what do you do there?
So it's very exciting. We work with organizations all across the country from all different sizes and needs. And as the Chief Experience Officer, we really want to go in and help them create a better environment for not only the employees and physicians and team members and leaders, ultimately creating the best experience for their patients and families and communities in which they serve. And we do that really by helping them kind of transform their culture and renew their passion and why they went into healthcare for the first place. Sometimes along the way, after they've been practicing in healthcare, we kind of get into our routines and forget about that passion and reason why we went into healthcare. So the work that we do really helps kind of bring that back to life. We really help kind of create those breakthroughs for them and engage them really in kind of bringing out that culture of trust and integrity and respect with one another. It's deep work, and it's really a kind of human-centered work and bringing back the relationships that they have with one another so that they can really be operating at their peak performance. And so it's really exciting work that we do.
Yeah. So on this show, we talk a lot about healthcare innovation and commercializing innovation to really be able to drive real change and transformation across the world. So when you talk about trust, when you talk about culture, these are intangible things. So why is that important to the work that we're doing around innovation? How does it all fit together?
I'm really glad you asked that, because I think it's at the core of what we do when we're really talking about culture transformation. And culture transformation can be at the root of all the things that healthcare really strives to be and do. When we talk about quality metrics, we talk about patient safety, when we talk about patient satisfaction, medical errors, burnout, all of those things are what healthcare leaders are striving to be the best at. And if we don't have trust, if we don't have respect, if we don't have compassion, and all of those things are the root of medical errors, right? And quality measures and actually ROI and finances. So sometimes if we miss the mark on our relationships with one another and there isn't any trust at the leadership level, all of your metrics are going to fall away. And so it's interesting, the founder of the Institute for Healthcare Excellence was working at a very large, prominent health system in Florida. And he was tasked as the chief quality officer to say, we're really not living up to our brand promise. Our scores aren't really matching, our metrics aren't matching what our brand promise is. We need to do something about it. And so he created this program to really change the way things are, and it really moved the mark. And so he and a few other leaders left and went to prove it at another health system in North Carolina. It worked there. They created this collaborative in Florida and said, okay, now it works with all these other types of health systems. We're really proving out a really cool model. How about if we create the Institute for Healthcare Excellence? And that's when it was born in 2015. So I felt like our founder was very innovative in really trying to provide something that would impact everybody.
So I think that in some ways, I don't want to claim that we are naive by any means, but I think in some ways, we kind of think, well, we're in healthcare, we're all trying to help people and do the right thing. Aren't we already working towards excellence, with our measures? So kind of just help us get an understanding of like the current state in general of healthcare organizations. Like, do we have a culture problem? Are we saying, I think in most organizations, you've got values, you've got things that organizations say they stand for. And my experience has been just something that they hang up on the wall, put on the website, and don't necessarily have programs or purpose of how are we actually weaving this in and out of the organization and living this out. So, share what are some of your insights about the state of that?
Yeah, so when we go into an organization, that's exactly it. They're usually values on the wall and things that maybe the frontline teams don't really resonate with. And it seems like there's a lot of broken trust between the frontline teams and the leaders. Mm-hmm. There's not a lot of visibility of leaders with the team members. And so that really breaks down that trust and that respect, and not really sure, that the leadership understands what's happening on a day-to-day basis. They're really not in tune with what's going on. And so our work really helps those leaders become more human-centered. We have a human-centered leadership program that really helps them understand not only the technical aspect. I think they really understand how to be a leader from a technical capacity, but what about a human capacity? How do we be vulnerable? How do we listen differently? How do we take that time to provide the right feedback or feed forward during our reviews with our team members? How do we get to know people at a different level so that they can build back that trust? And so really starting with the leadership team to help them understand their team members, how to understand each other so that they can be a better cohesive leadership team. And then those values do come to life on a whole different level.
So I was giving a keynote presentation a few weeks ago around this idea of driving adoption of innovation and the importance of change management and how these two really interplay with one another. And a lot of times when we are rolling out innovation, we're not necessarily packaging that around or with a change management plan and process. And so we've got all of these healthcare innovations that are really wonderful, that really we've got really zero or low adoption rates. So how does what you're talking about fit into that equation to really be able to drive that innovation? What are some of the things that you're working on, your team is working on that is trying to help overcome some of those barriers to adoption through those measures?
So true. One thing we're doing right now, and then I'll go back a few years to talk about an innovation that we did. But right now, really to get that sustainability and adoption and the practices hardwired, because that's the only way you're going to get that culture transformation, is you've got to have that leader at the very top, the CEO, the chief medical officer, the chief nurse officer. You have to have their buy-in from the very top, saying this is something that we're committing to, we're investing in, and we're in it for the long haul. And then also we have to have our physicians engaged. You know, they've got to be part of the work and the equation, because if the culture is going to change and the common language and the framework around the work is going to be implemented, they have to also be on board. Otherwise, you're only going to have half your team moving in the right direction. So those are two must-haves when we go in and work with an organization. Your absolutely top senior leadership has to be, yes, we're doing this and committing to it. And then your physicians have to be on board and included and engaged. So that's something that we learned early on, and said those are givens. We have to have that. The other innovation that we created back in 2017, 2018 was we were part of a group, a national group, thought leadership group, and we were really thinking about this, thought about burnout. You know, it was just really becoming such a topic about burnout and what it's doing to our teams and our healthcare organizations, and a lot of focus on it. We really understood what burnout was. And we were working with Dr. Bridget Duffy and Dr. Ron Paulus, and Dr. Bill Maples is our founder at the Institute. And we came up with this idea of, what if we put together a national task force for humanity in healthcare and asked for 5 to 10 pilot organizations across the country to come together and say, we want to sign up and we want to test a solution, test a metric for humanity. Let's create a metric, because we know there's a metric for burnout, but what about a metric for humanity? Mm-hmm. What if we also tested, like, what does a team of thriving look like? What if we shifted the focus on deficits? Like, how bad off are we all the time? But what if we shifted that from one to, what does a team of thriving look like? And can we measure that? Mm-hmm. After like a pre and a post intervention, what if we looked at teams of thriving and wanting more of what a thriving team looks like? So we partnered with Marcus Buckingham and also Dr. Brian Sexton, and we had engaged with the American Hospital Association, and we found 5 pilot sites, different types of units and departments from different health systems from the East Coast, the West Coast, central part of the state, outpatient, inpatient, all different types, really strong leaders, some mediocre leaders, and they embarked on this 2-year journey with us. Mm-hmm. And the Institute for Healthcare Excellence was the operating arm. So we devised a comprehensive solution called Solutions for Thriving. And we went into each organization and helped work through a 9-month process with each one of them, and kind of helped co-design like what really meant the best for them, and did the pre and the post measurement, and did the solution for thriving with them. And we actually published a paper in the Joint Commission Journal for Quality and Patient Safety on the results. And it was remarkable on the transformation that these 5 organizations were able to achieve. And then the pandemic hit. And we were able to get through, though, the solution for thriving, you know, just as that happened. But really starting with that human-centered leadership after the assessment and the pre-measurement was critical. And I'm talking leadership from the top of the organization down to like the charge and lead level, mm-hmm. and Amanda really developed those skills. And then, yeah, so it was really.
So I can imagine, you know, health innovators in our audience that have like tangible products that they in innovations that they're building and bringing to market that are struggling to get pilots. And here you are, able to actually get 5 pilots going on at the same time, on this very intangible innovation, this idea of leadership and thriving, a thriving culture. How difficult was it to actually get these institutions to buy into this piloting idea? And then what are some of those like aha or key findings that were maybe some unexpected?
So difficult to get people on board, obviously, because this work had never been done before. We were trying, right, as innovators do, you just
Yep.
hope for, interest. We were part of what was called the Experience Innovation Network, this thought leadership group out of San Francisco, which Bridget Duffy and Dr. Ron Paulus and Dr. Bill Maples had created years ago.
Yep.
And so we had this kind of membership organization where there were healthcare leaders that we could go to and say, does anybody want to sign up? And it did take about a year of conversations.
Yeah.
Going to them and saying, here's what our hope is. Here's what we're hoping from a metric standpoint that your teams would be able to leverage out of this, and the intervention results is what we are hoping to do. And we were really fortunate to have senior leaders sitting at the table, raising their hands, trusting what these 3 executives were wanting. And so we were able to really, have multiple conversations, and, just to work with Brian Sexton and Marcus Buckingham were amazing to have their partnership. And, each pilot site had to contribute financially to the work. So they had a stake in the game, I think, which was really important.
Yeah, definitely.
Buy-in, that was really important. And then to be able to be published themselves and have those results. And I think a couple aha moments were walking into those organizations during the assessment and seeing the level of burnout in their physicians and some of their leaders, and watching the despair for them and saying, this isn't going to work. I don't see it. I don't know why we're doing this. And then about the 3rd or 4th month of returning and seeing the sparkle in their eye and like, why didn't I have this skill before? Why didn't I see that I could be a human at work? Where was this before? Like, I feel bad for my patients before this work because I was not able to connect with them in a way that mattered to them and mattered to me. And then to see the results post intervention, where there really isn't any other intervention to date that has seen the shift of burnout to thriving like this. And so the impact that it's had on individuals and on the organizations is just, it's inspiring.
So have you all been able to kind of create like an ROI story with this, right? Business impact, again, going back to, so many innovators are pitching their stuff to these, payer and provider organizations and trying to, they're all busy. They don't have a whole lot of money. They don't have a whole lot of time. And so, when you're going in and pitching this, you've got to have a story that's compelling, and you've got to have a story that is going to demonstrate some type of financial ROI, not just, oh, patients will feel better and your employees will feel better. So tell us a little bit about that.
Yes, completely. It is an amazing ROI story. You're right. It's not just about feeling better and being able to talk to my patients better, but right now the story in healthcare is recruitment and retention and keeping our nurses and physicians within our organization. And we're just published on LinkedIn yesterday some information on the ROI around if you do this work in keeping your teams, I mean, the ROI is incredible. It's in the millions, right? Even decreasing grievances, we've been able to track that based on this, and it's annually, it's in the multi-million dollars. So, and that's just dollars, right? But if you stop a grievance or two, just think about the emotional toll it takes on your physicians and nurses and team members to not have to walk through that. So it's multi-layered in how you can quantify it at many different levels. Medical errors, you think about that. So you can look at it from, a retention standpoint, medical standpoint, grievances, quality, safety. We have all of those that we're looking at.
So I don't know that you have the answer to this, but I'm just curious. One of the questions that come to mind is, I think that we can probably all rattle off at least 10 to 20 different healthcare organizations across the country and the US that are kind of leading the way as far as innovating from like a digital or technology standpoint. I wonder if those are the same organizations and leaders that are also open to innovating their culture and their employee experience and their leadership and their humanness, or if it's really characteristically a very different type of organization that is embracing that kind of innovation that you're bringing to market versus the technology stuff.
That's a really good question. I think it's probably a both and. We work with all sizes of organizations. We're working with organizations, that aren't technically savvy and not innovative. Really are, caring about their team members and their leaders, but also working with the large ones that are innovative that way too. So I think it just depends on that top level leader and what they're impassioned for. So
So we talk a lot about the commercialization journey. It's usually different when you're bringing something that's just an incremental innovation to market versus something that's pretty revolutionary, never been done before, which is very much what you guys have done. So share some insights, maybe lessons learned along the way of, you had this brand new idea, never been done before. It's not even tangible. So as you're bringing this revolutionary innovation to market, what are some of the obstacles that you had to overcome, or maybe even still overcoming, to be able to bring your solution to, penetrating the entire market across the country?
I think one we're still trying to overcome is, how do you describe this to those senior leaders? Because it is so intangible, and it is life-changing. It's not just skills for people that go to work. There's skills that impact your entire life, your home life, your, everything that you do. So how do you tell the story? How do you go in and say, this is culture transformation work? How do you describe it without them experiencing it? So messaging that in a way that's succinct and will get to that top leader is a challenge. And that's why conversations to get to them and describe it take a long time before they actually say yes. So that is something that we constantly work towards. I think the second one is, once they engage with us, is helping them understand the level of engagement they're going to need over the process, and really having the right people at the right table, and being upfront about the level of, it's not a quick fix, and it's not going to change overnight, and culture transformation takes time, and there's a commitment to the sustainability that needs to happen. And it's not us. We go in and we help facilitate the learning, but we actually facilitate them to learn it so that they spread it throughout their organization over the years. We're not the ones going in and staying with them. We're facilitating their learning.
Which I think is so critical for that transformation, right? There has to be that ownership on their side as well, right?
It's peer-to-peer learning. I mean, we're not going to transform their culture. So we teach, their physicians to teach, their peers. So
yeah. And, so many times I think that innovators are landing those pilot customers or even paying customers that are beyond the pilot. And it's almost like this perception that I got to the finish line because we sold the deal. And it's like, that's really the starting line because you want to make sure that that's a success story. And so you've got to plan for all of those resources to be able to deliver it, but then also to be able to champion it and make sure that it doesn't get stalled, that it doesn't, if leadership changes, that there's another champion to kind of bring that through. If competing priorities start to kind of percolate, that, some kind of way there's a mechanism for reminding people why they're there and why this is important and shouldn't just get shelved because, another initiative came on board. It takes a lot to make sure. And like you're saying, that this is not something that's like a 90-day project. It's like, you've got to be able to shepherd this for a couple of years.
And I also think, it goes back to the work that we do with them. During this process, it is about the relationships. So whether or not you get the deal or you move forward with them or not, it is about how you manage that relationship from the moment you connect with somebody for years, because you never know where that person is going to go next. And think about, I really had a great relationship with that person, and then they contact you down the road. So it is always about the relationship and how you manage that. And so I think it's super important because we never know where we're going to see people again.
That's the humanness, right? And all of our business, it's just people doing business with people. Oh, yeah. So Jennifer, as you kind of like think about our audience of innovators that are bringing their own revolutionary idea to market, or we've got leaders, those payers and providers that are the ones that are buying these types of solutions. Is there anything else that you would want to share with our audience before we wrap up today?
Oh, it's exciting. I think this world can't have enough innovation. And I think what we found throughout the pandemic is that we can innovate and we can work together across silos, and we can do amazing things when we come together for the common good. And I say, share with one another, because I do know that we can learn from one another. So don't be afraid to share. Don't be afraid to reach out to people. And I think we learn from one another. And I think this is an awesome way for people to learn through your podcast here. So I appreciate you having the podcast one just to support innovators in healthcare. And I think it's been such a pleasure to be with you.
Thank you. And I did not pay you to say that. Well, thank you so much for sharing your journey and your insights with our audience today.
Welcome. Thank you.